As many as 13,000 may have been exposed to fungal meningitis from tainted spinal steroid injections. Now some are calling for increased regulatory scrutiny of compounding pharmacies that create such customized medicines. We're joined now by Wall Street Journal's Timothy Martin. Timothy, good morning.
Good morning.
I wanted this shines a bright light on compounding pharmacies, and you note in your story that these kinds of pharmacies, these specialized pharmacies, have really fallen through the regulatory cracks. Well, why is that? And who oversees them today?
It's a two-part answer. I mean, the pharmacy industry, states, and the federal government all play a role in regulating these compounding pharmacies. Now, the FDA, if you ask them, they'll say that these are considered pharmacies and therefore under the regulation of each individual state's pharmacy board. Now, the pharmacy boards all have varying levels of ability to have oversight, conduct visits, and make sure that, for instance, these pharmacies are following their own rules.
You mentioned the FDA really saw this coming, correct?
The FDA has looked at to what extent they should have oversight or jurisdiction with these compounding pharmacies for several years, and it's been a situation where it's gone to Supreme Court, and the FDA has been stymied in part in their efforts to really take a more aggressive role in having oversight of these compound pharmacies.
Is that oversight? Are we going to get that kind of oversight? Lawmakers are calling for that. Is that likely at this point?
Yesterday, two lawmakers, Representative Markey and Senator Blumenthal, called for, if needed, that the FDA have a much more assertive role in monitoring the safety of the products that come out of these compounding pharmacies.
I'd like to bring in Dr. John Jernigan now, a medical epidemiologist from the Centers for Disease Control and Prevention. Doctor, 13,000 have been exposed, 105 infections have been identified, 8 have now died. What is the CDC doing to respond, really to control this outbreak?
Well, the first thing that CDC has done is to participate in the investigation to find out exactly what contaminated medication was. And now that we've discovered that all the cases that we've identified so far have received injections from one of the 3 recalled potentially contaminated lots, we're reaching out and working with state health departments and the clinics where the patients receive their injections to contact each and every one of these patients to find out how they're doing. Are they having symptoms? If they're not, to let them know to be vigilant for the onset of symptoms, to be able to seek medical care.
Doctor, how were these injections, how did this contamination happen? Have you been able to determine that at this point?
We still don't have all the answers about how the actual contamination occurred. The investigation of the compounding pharmacy where the medications were formulated is being conducted by the FDA, and we don't have all those answers yet.
What are the symptoms, again, of fungal meningitis, and what's the treatment? It's curable, correct?
That's correct. The symptoms can be new or worsening headache, stiff neck, fever, sometimes nausea or dizziness. We also encourage patients to be on the lookout for symptoms consistent with stroke, such as sudden onset of slurred speech or weakness or difficulty walking. We do have antifungal agents available. CDC is providing treatment recommendations for clinicians so that they can have guidance when presented with one of these patients.
Has the outbreak been contained at this point? Could there be more exposures later?
Well, the potentially contaminated lots have been recalled, and our hope is that those medications clearly aren't being used anymore. You might have noticed that the case counts have increased in recent days. We don't think this is because the outbreak is spreading more rapidly. It's simply because we're doing a better job at finding these cases. Again, as I mentioned, we're reaching out and trying to contact each and every one of these patients who may have been exposed. And in the course of doing so, we are identifying people that have symptoms, and we've encouraged them to seek medical treatment, and in some cases, we found that they do have the infection.
Okay, Dr. Jernigan, thank you so much for joining us this morning.